A brief introduction to the anatomy of the knee in an effort to better understand what tissues are responsible for your specific pain. So as we zoom in on just the bones of the knee, we see the kneecap. This top bone is called the femur. This bottom bone here is called the tibia, and this is your fibula, always on the outside of the leg. Now what's interesting about this arrangement is you can see how there's this smooth surface here compared to this porous surface here. The smooth surface is a joint surface or cartilage. Now if we zoom out and add some muscles in, we start to identify some areas or concerns of pain. If we add in the connective tissue, we see how these bones connect. And this is what the capsule looks like. So we see our ligaments, medial collateral ligament, lateral collateral ligament, and then our patellar tendons, the top and bottom. If we add in our muscles, we can see where these important ones come into play. And this is often sites of pain. So this right here, we get issues of the inside of the knee, just below this knee bone or shin bone, to the inside or medial side. We get a little bit of pain here. It's called pezanserine bursitis. This medial knee pain is often because we have a lot of friction occurring from our knee flexors, our knee adductors, which bring our leg inward, as well as this muscle that comes, this is the sartorius, that comes up from the hip all the way down and kind of brings our leg up and in. These are all contributing to this pezanserine bursitis. On the outside of the leg, we have one that's commonly misconceived as the problem, our big IT band. And so you can see how our IT band has a little muscle up here called the tensor fascia lata that integrates in with this long, rigid band. Inserts all the way down just past the knee. So we have a point of friction on the outside of the knee. This is often where, if folks have a true IT band syndrome, it'll be friction over the outside of the knee. Often we'll get point tenderness on the middle of the thigh, just on the outside of the thigh, and that's because of more vastus medialis pain, or this musculature on the outside or quad muscle will become painful and tight. And this is because of how integrative our hip muscles are to that IT band. So you can see how these integrate. Tensor fascia lata and glute all integrate into that IT band. So if we have a lot of friction from our IT band, we look at glute strength. So why it's so important that we'll look at glute or hip strength to treat knee is because of the integration we have into these structures that go down into the knee. Good hip health contributes or correlates to good knee health. Same with ankle. Reason being is we can see this calf, gastroc, goes up and just past the knee. If we add those back in, you can see how we have muscles that now come up just past the knee. So they contribute to knee flexion as well as pointing your toes downward or raising your heel off the ground, like to jump or to run. Knee flexion is bending the knee, so if I'm going to pull my heel up towards my rear, that's knee flexion. Knee extension is going from a bent knee, like if I'm sitting in a chair, knee extension is going from a seated to a standing position. Knee flexion is going from a standing to a bent or seated position. So we do want to pay a lot of attention to muscles that cross the ankle, muscles that cross the hip, in order to take care of our knee health. The other muscle that's unique is this vastus medialis on the inside because of how often we get wear and tear on the outside of our kneecap. This surface here, just below all these muscles, kneecap will wear down, and this is where we get arthritis. So folks who complain of knee arthritis or patellar chondromalacia, if I were to take this kneecap and flip it over, there's joint surface, this smooth joint surface material on the back side of that kneecap. And in order for this kneecap to move properly in this track, we need an appropriate balance of strength across these three structures. Really there's a fourth one, but the fourth one's underneath this top one, so we only see three. What happens though is this muscle gets neglected, not necessarily intentionally, but it doesn't get the strengthening exercises it needs because of how difficult it is. It requires a lot more force to push our leg straight in order to exercise this knee. So if we're just walking, we're not going to strengthen this knee, and then we get this maltracking or this tracking of the kneecap that contributes to more knee arthritis. If all we're doing is walking for exercise, we're going to produce a muscular imbalance that contributes or causes this kneecap to not move correctly through the track. And is it not moving correctly through the track? Just like if your tires or your wheels are not in proper alignment, you're going to wear down tires faster. You similarly will wear down your knee faster if we're not having appropriate strength across these three poles. So we're going to talk about exercises to help strengthen the vastus medialis, to strengthen the gastroc soleus, or these muscles here on the backside, as well as how to strengthen our hip and glute to make sure that our knee is tracking correctly so we can slow down the process of knee arthritis as well as help improve the function of the knee after a meniscus tear that does not result in surgery. One of the most common knee injuries is a meniscus tear that didn't need surgery. Most of them are. So we're going to talk about ways we can strengthen and improve knee function in the presence of arthritis and small meniscus tears. Glute strengthening is really important to help with knee health because if this is weak, I tend to turn inward. And the more inward I turn and then extend my knee, the more that positions the kneecap in a spot that's going to wear and tear on the outside of my knee. So if this is strong and helps to track my leg over top of my foot and keep it in relative position between hip, knee, and ankle, I'm now encouraging my kneecap to track or move in the groove it's designed to move in so we don't wear it out unnecessarily. Oftentimes glutes will get weak. What's also really important about our glute strength or glute health is from the backside, if I stand on one leg, it helps to prevent this pelvic drop. And this pelvic drop then forces my foot more into the midline and can cause more wear and tear, especially if you're having pain with running. We see this very, very often. So one of my favorite exercises is, again, up against the wall. We're gonna come up to it, step out just slightly, and then lean into the wall. And step out far enough to where it feels like if the wall wasn't there, I would fall over. And now what I'm gonna do is I'm gonna push into the floor, like I'm gonna try and push the wall over. My leg closest to the wall, I'm gonna push into the wall, like I'm trying to push the floor away and push the wall over. And with this leg, I'm pushing into the wall. I'm gonna hold 10 to 15 seconds. You'll be surprised at how quickly this wears out because these glute muscles are tired. 5 to 10 seconds, up to 15 if you can, and we're gonna repeat this 10 times on each leg. So we'll flip around and do the other side. Again, lean into the wall, step out just enough to where it feels like if the wall was not there, I'd fall over. Bring the leg up, slight bend in the knee, and I'm gonna push into the wall, trying to push the wall over. And you're gonna feel this is the glute muscle up here that's active and working. Repeat that 10 times, 3 to 4 times a week. My other favorite exercise for strengthening the glutes is a simple glute bridge. There's tons of videos out there with different glute bridge techniques. The one that I really like is a single leg glute bridge because it helps to isolate all our hip extensors as well as our hamstring. We didn't talk a lot about the hamstring, but it's also vital to knee health. This is an easy way to incorporate some hamstring as we work on our glute strength. And the way to do a single leg glute bridge is lay down on a surface, raise one leg up just to about 90 degrees or as if it's in a chair pose. This is the one that we're going to work on. We're going to flatten out our back, really tighten that up so it's not part of the extension, and all the extension is coming from the hip, which is what the glute and hamstrings do. We're going to squeeze, raise up. The idea is to get our knee, hip, and shoulder all in line. So getting to the very top is where it gets quite challenging. The other thing that you're going to notice, I'm not wobbly in my knee. I'm not letting it fall in or fall out. I'm smooth and steady, working on that full extension into the hip. 2 sets of 10 to 15. If you can get to 15, great. I totally understand if you can't and we need to stop at 10. All the while we're trying to get all the way up into a neutral or straight position. Do it on both sides. Yes.